In terms of length, I think this is a very big misconception that people think that they're getting this bionic penis that they can now make longer or girthier than what they already have.
So in terms of length, that's probably like the question that everybody gets you, right? And it's like, Doc, like, can you make it bigger? Like, I always ask him every morning when I go in to do the surgery, I ask him, like, do you have any more questions? And every single patient asks me the same thing. It's like, Doc, make sure you get the biggest one.
Yeah.
Right? It's like, please, if you can add an extra inch or two. But again, there's no way we can do that. I mean, we provide them with whatever their penis provides that day. So I had a friend from Puerto Rico who jokingly told his patients, it's like, well, if you bring me a Prius, I'll put it in a Prius. If you bring me an 18-wheeler, I'll put it in an 18-wheeler. So again, we can only size you to fit. Right? We cannot oversize you. Otherwise, imagine you're going to have excruciating pain. You're going to have an implant that's trying to find its space inside your body, which eventually it will. And what can happen is that implant can end up eroding through the penis. Mm-hmm. So again, we only size to fit. Can it increase length? Very unlikely. At best, you're probably going to get close to what you were before when it comes to length. And when it comes to girth, sometimes there are implants that are so strong that there are some guys that they say that they can get a little bit thicker. So girth can sometimes improve. I never promise it, but it can sometimes improve, but length definitely will not improve.
Yeah. And I tell people sometimes they feel like it's a little shorter because if the gland is not engorged, which again is a blood flow phenomenon, then it will look shorter because the gland is not engorged.
100% agree. I always tell people the worst thing you could do whenever you take the dressings off is try to measure your penis. All you're looking at, even if it's partially inflated or even if they left it fully inflated, all you're looking at is your flaccid penis with an implant. Again, there are multiple things that happen when we get aroused. The head of the penis engorges, and also the urethra on the bottom side of the penis will also engorge. And when they pump up that implant, the penis even looks a little bit flat. And it's not until they get engorged that everything now starts looking a little more cylindrical and they're able to get close to what they were before.
Yeah. Yeah, absolutely. So in terms of increasing length, prior to an implant, there's some studies that have shown using vacuum erection devices or doing different maneuvers prior to surgery can help. Is there something that you generally recommend?
Yes. I mean, I believe that the best thing that a guy can do in order for them to prepare themselves for surgery is to get an erection, be it with taking medications. If you're still using injection, continue using the injections, even if they partially work, because sometimes they can they can help expand the tissues in order for us to be able to get an implant in. And the vacuum pump does more or less the same thing. Again, if you haven't had an erection in 25 years, don't expect for you to be what you were when you were 18 years old. But I mean, if you're still having partial erections and now you're worried, you're waiting to get your implant, one good maneuver, one good thing that a guy can do is start stretching it with a vacuum erection device.
And so is there a certain number of minutes you tell people to do daily, or if say they're like, I'm really aggressive, I want it to get as long as possible, let's take that guy. What do you tell them?
I start laughing because there's many guys who just start using that vacuum pump every single day, all day, every single day. And they're like, Doc, I used it, for 3 hours today. It's like, don't do that. I mean, you're going to get bruised.
Yeah.
And what I try to tell people is imagine that you're having sex, right? When you're having sex, usually you're having sex for what? 5, 10, 15, maybe 20 minutes at a time. You're not having sex for 3 hours at a time, or at least you could be having sex for 3 hours, but you're not having a full erection for 3 hours, right? So I try to tell them, so what we try to do is we're trying to replicate, like if you're having a really aggressive sex life, and usually what you have is, again, maybe 2 erections in a day, and probably doing it for 10, 15 minutes is more than enough.
Yeah. Yeah, I think that's reasonable. I tell people start with 5 minutes,
exactly,
twice a day at most. And if they feel like they're doing a little more, that's fine. But I think 5 minutes twice a day is probably sufficient.
To be honest, yeah. Usually what I tell them is you get the vacuum in, you start suctioning it, you suction until it starts hurting. Once it starts hurting, you stop the suction. You hold it there for about 10, 15 seconds. You do that 10 times. The 10th time, keep it there for about 2 minutes, which will probably round up to like 4 or 5 minutes.
Right.
That's more than enough.
Yeah,
more than enough.
I agree. So in terms of cycling, you mentioned cycling. What is it, right, for patients who don't know? And what is your protocol that you recommend for patients?
So cycling is a process of inflating and deflating your implant. It's as easy as that. It's just getting it up, and getting it down. So the science behind the cycling process is the following: when we get a penile implant inside the body, specifically when we get an inflatable implant, because you cannot cycle a malleable implant, but when you get an inflatable implant inside the body, we want to expand those tissues within the actual penis as much as possible. Why? Because every time we put in a foreign body inside a person's body, the body will start creating this surgical capsule or the pseudo capsule. And it's this sheath that will start forming around it. And that's the way that the body will protect the rest of your organs from that foreign body. So what we try to do is we put in that implant. We want that capsule to be as expanded as possible. So that cycling process will hopefully start stretching out that capsule so that whenever that capsule ends up forming, it forms on a fully expandable state. How long will it take? There are some experts that suggest that it could take up to about 3 months for that to form. There are some experts that say that it starts forming as soon as day one. I'm not a big believer in that, but usually in general, it takes 3 to 6 months, so sometimes even up to a year for that capsule to form.
Yeah.
So what we try to do with cycling again is just trying to expand that capsule.
So when do they start?
So usually I tell them, it all depends on the surgeon. Every surgeon has their specific protocols. Again, there are some surgeons that start them as soon as day 3, day 4. I'm not a believer in super early cycling. And the main reason I'm not a believer is because I believe that super early cycling leads to 2 things, which is pain, because again, there's a very sensitive area that just underwent surgery, and also anxiety. Why? You're not able to figure it out. You're still in pain. Again, you have to fully pump that thing up. It will take 20, 30 squeezes on an area that's super sensitive, and also deflating it. And you're going to get anxious, frustrated, and all you're going to be thinking is like, am I doing it right? And they're going to start freaking out.
Right.
So what I tell them is, hold off probably for about at least 3 to 4 weeks. So I tell them, do not do it sooner than 3 weeks. I feel better when they start doing it around 4 to 5 weeks. And then by the 6-week mark, they should definitely start doing it.
Yeah, I would say the majority of patients are still swollen at 3 weeks. I see them all at 3 weeks post-op, and I'd say the majority are still a little swollen. And so it's still a little uncomfortable for them to feel for the pump. And so the pump, because we didn't actually describe it, is actually just a little balloon that's in the scrotum that you pump up. And it does take like 20 to 30 pumps. Are there maneuvers outside of ice packs that you tell people to help reduce the swelling early on?
There's multiple things that we can do. I'm a believer in supplements like arnica. I'm a believer in tight underwear initially. So the worst thing that a guy can do is kind of like start going like completely nude.
Commando.
Commando, that's the word I was looking for. So yeah, so that's the worst thing that they could probably do. So usually what I try to tell them is like, try to get an underwear that will help support your testicles while you're still having your penis sticking out. I try to encourage them not to kind of like let it hang, let it do its own thing. But for swelling, that sometimes if they have a lot of edema, sometimes I try diuretics. I'm a little bit like closer to the plastic surgery world or the plastic surgery philosophy. So sometimes I can add steroids. Of course I would do it with antibiotics. That hasn't been studied that I know of, at least. It hasn't been studied with penile implants. So again, I'm not going research based here, but sometimes I do rounds of steroids to start to help reduce swelling. So there's multiple things that we can do, but in general, time will usually take care of it.
Yeah. So do you put everyone, so tight underwear, ice packs, probably for everyone. Mm-hmm. Do you have everyone start arnica?
So not everybody. So I tell them that these are just things that you can try. The one thing that I do for my patients, I always keep a dressing that stays there for 48 hours. Because after every surgery, our body will start processing fluids in a different way. That happens with every surgery. Everybody gets swollen in a different spot, right? So what I try to tell guys, like I'm going to try to keep your testicles and your scrotum as tight as possible while you are reprocessing all these fluids and you pee everything out.
Yeah.
So, and then 48 hours later, they remove the dressings. If they're on blood thinners, I usually keep them for 3 days. So that usually whenever they take those dressings out, usually most of the swelling's already pretty much gone.
So in general, what can people expect during their recovery?
Recovery is so unpredictable. I can do the exact same surgery 100 ways and I can have probably 50 different outcomes. There are some guys that in terms of pain is a very common concern. It's like, doc, how much pain will I have? And pain is subjective. There's people who tolerate pain a lot better than others. I have some guys that are able to take maybe 2 Tylenols, for the first few days, and that's it. And then there are others that require pain medications for the full 6 weeks. So everybody is different. So when it comes to pain is unpredictable. Of course, if you do have pain, let your surgeon know. It's the most important thing. If you are doing well and all of a sudden now, so let's say you're 2-3 weeks out, everything's going well, and all of a sudden in the 3rd, 4th week, now you start noticing some swelling, more pain, more like burning sensations, let your surgeon know right away, right? We want to make sure that there's no infection. But in general, yeah, I mean, it's going to be a process that will take 6 weeks. There's going to be swelling, there's going to be bruising, there's going to be, some tender bruises around the head of the penis. That's where we perforate, to get the needle through. And it's just a matter of just staying the course. If you have any questions, ask your surgeon. And that's, we try to provide them with as much education as possible, be it through YouTube, be it through written material. And that way we can put them at ease a little bit.
Yeah, if you're already here, you're ahead of the game, right? You're ahead of the game. But in terms of, things to look out for, so you mentioned burning, you mentioned pain that's not getting better, you mentioned redness, drainage, that sort of stuff. What other things should people worry about? I
mean, the fevers, chills, if you're having you're having vomiting and you're not able to tolerate anything by mouth, I mean, that's something to look out for, right? We place a reservoir that's placed in the abdomen, and most of the time we're placing that blindly. I mean, I've never had any patient having any issues with bowel obstruction, but it can definitely happen. But the most important things is, fevers, chills, having redness around the incision that wasn't there before, again, new onset of swelling, and most importantly, if the incision opens up and starts draining, that is not normal. So you should contact your surgeon right away so we can make whatever remedies needs to be made.
Yeah, if you see any part of the reservoir, come in immediately.
Oh, of course.
Any part of the implant.
Any part of the implant, that's fine.
Yeah.
If you see any part of the implant that is not normal, you should go see your surgeon right away.
Absolutely. In terms of lifespan of the device, right? How long does the average implant last?
So usually implants last anywhere from 8 to 15 years. That's on average. But again, this is a little bit like a car. I like the car analogies all the time. And I tell them, if you get a lemon, it might last you 2 years. I mean, but that's super rare. In general, it's 8 to 15 years. There's been several studies looking at this. And one research study basically showed that at 5 years, 95% of implants were still working. At 10 years, about 80 to 85% of implants were still working. And then at 15 years, 70% of implants were still working. I am not a big believer of that study. Again, that's just me. So that's just me as Jonathan Clavell speaking. So what I tell them is like, hey, this is a medical device and medical devices fail. The same way that a knee replacement is not going to last you forever, a shoulder replacement is not going to last you forever, a breast implant doesn't last forever, this will eventually fail. You might wonder, like, why you don't believe in that study saying that 70% lasted over 15 years? And the reason is, I mean, there are many patients that get lost to follow-up. And if I'm doing a study and I do an implant on your husband, for example, and I don't see him ever again, I cannot assume that his implant is working because he probably went to somebody else and then the implant's not working anymore. Yeah. So again, these studies, I mean, these are mostly single surgeon. There are some that have been multi-institutional. There's one study in Spain that showed that 50% of implants were working at 20 years. I don't believe that either.
That's a long.
It's a long. So if you ask me, what's the longest implant that I've seen working? 22 years. And I actually saw it two weeks ago.
I saw 20. I saw 20 year. It was still working, and he was great. He was doing great. But that was one out of
exactly. And the cool thing about it is that this is something that usually it's implanted into older men. I mean, they tend to be the ones getting implants. Just in case if somebody was listening to us and they are young, and that doesn't mean that they're not candidates for an implant. I mean, there's not you check the 50-year mark, now I can get an implant. It doesn't work that way.
You know what's so funny? I had a patient who came to me and he was told he couldn't get one because he was too young.
Yeah, I mean, you get those often, and it's frustrating, right? Mm-hmm. And you're like, yeah, I mean, if you've tried, medical therapy and you have a reason, we don't have to wait. But in general, again, these tend to be older men. So if you're implanting a guy who's 83, 84 years old, it's very unlikely they're going to live above 100 years old. So again, an implant that's, 10 feet underground on a grave, it's not an implant that works. So I cannot count that as, that implant is still working.